Can the way you sleep help correct your scoliosis? When I consult with scoliosis patients regarding their lifestyle, and the most common question I get asked is like, what's the best sleep position? And that's a very common question. Like, can I sleep a certain way to help my scoliosis? Should I sleep on my left side if I have a left curve, or my right side? Thinking that, in this sleeping position, I can maybe try to improve my scoliosis. First of all, when it comes to sleep, we know sleep's important for all types of patients, but especially patients that are actually going through scoliosis treatment, because we know good sleep typically means the body can heal better and respond better, and they normally can respond better to the treatment that they're receiving here in Scoliosis Reduction Center. We also know a good rested body means the body has more healing power to help recover and heal from whatever they're adverse or whatever they're dealing with. And obviously scoliosis, we know that as they're going through treatment, they're trying to overcome the curvature size and actually reduce these curves. So what is the best position to sleep in if you have scoliosis? And really, it's not a lot different for patients with or without scoliosis, because the goal of sleeping is to maintain a healthy spinal alignment. We know we want to try to maintain the spine straight from the front, and we also want to maintain the normal natural curvatures from the side, meaning the lordosis in the neck, the kyphosis in the mid-back, and we also recommend the lordosis in the lower back. So we're trying to maintain this normal, healthy spinal alignment without severe pressure points, so you can rest comfortably and sleep well. The best position by far for patients to sleep in, regardless of whether you have scoliosis or not, is normally sleeping on your back with very slight supports for your neck and slight supports for the low back if they're needed. We don't recommend big puffy pillows that bring your head forward and create forward head posture. We also don't recommend sleeping in any kind of in position for spinal alignment, meaning sleeping slightly inclined or sleeping on your left or your right, thinking that it's going to reduce or improve your curve. If you sleep on your side, that's the second best way to sleep, is to be on your side. And it's not because we're recommending that which side is going to have a better impact on your scoliosis. It's whichever side is more comfortable. And if you're sleeping on your side, we typically recommend something in between your knees to prevent your hips from torquing. And we also recommend something between your arms to prevent your shoulders from torquing. We want to stay as neutral as possible. And then on your side is when we recommend that you use a pillow that's big enough for your shoulders that actually supports your neck in a neutral position, that your head's not going to be torqued left or right or up or down. So this is where we recommend a pillow to use. Now, the size of pillow or type of pillow is going to depend on your body type, meaning the bigger your shoulders are, the bigger the pillow you're going to need. The thinner your shoulders are, the thinner the pillow you're going to need. So it's not one size fits all type of pillow. We recommend a pillow that's going to be fit for you to provide the best outcome if you're going to be sleeping on your side. So what's absolutely the worst way for patients to sleep with or without scoliosis? And that's going to be sleeping on your stomach. And the reason why sleeping on your stomach is so poor, even if you sleep better while sleeping in your stomach, is because it creates an unnatural alignment, meaning you can't sleep in a neutral position. There has to be rotation of the neck, and the rotation of the neck actually will create rotation of the shoulders, and it also creates typically an unnatural arch in the low back. Sleeping in your stomach exposes the spine to this pressure and abnormal alignment that we don't want scoliosis or even a patient without scoliosis to ever experience. So typically face down sleeping or sleeping in your stomach is by far the least recommended. And it's the least recommended because of what it does to spinal alignment. It affects it in a negative way, and there's no way to counteract it because you're creating a torque in the neck, arching in the low back, twisting in the shoulders, and it creates this negative effect to the spine. Sleeping in the back is the best because it actually improves spinal curvatures and it supports them. It distributes weight equally and it creates no tension. Now, the problem with scoliosis patients when they sleep on their back is because they don't have most patients don't have a flat back. They'll have one side of the ribs kind of stick out a little bit further than the other. They'll have the rotated pelvis. That sometimes laying flat on their back, they don't feel as comfortable as a patient who doesn't have scoliosis because they have asymmetrical pressure points. So scoliosis patients typically benefit from a slightly softer mattress top and not as firm to give them a little bit of relief in that area, but it can't be so soft that it doesn't support the normal spine curves. Now, for scoliosis patients, the best way for them to sleep is not on their back or not on their side to try to reduce the curve, but actually sleeping in a specifically customized corrective scoliosis brace, because the corrective scoliosis brace will be pushing on the scoliosis to actually reduce the curve. And now while they're sleeping, they're 6, 8, 9, 10 hours, the brace, the scoliosis corrective brace, will be pushing on the scoliosis to actually help reduce it. So the best way to sleep is sleeping in a corrective brace. And that's the only way that a sleep position can actually help a scoliosis. There's no sleeping on your left side or your right side to help a right curve or a left curve. There is no sleep position alone that can help correct a scoliosis or reduce a curve. However, healthy sleep habits are definitely scoliosis friendly, especially if you're going through scoliosis treatment, because we know in scoliosis treatment, your body is using energy and trying to heal and recover and reduce the scoliosis. So the better you sleep, the better you're going to respond to scoliosis treatment. And getting the right pillow size fit for you is also very important. We do that with all our scoliosis patients if you're going to be side sleeping. And if you're in your back, getting the proper supports to support the normal neck curve and low back curve is also very important, something that we fit for all our scoliosis patients to make sure they can sleep properly on their back. But the best sleep position by far for a scoliosis patient is sleeping in their corrective brace, which if our patients have that, that's what we normally recommend, that they have some sleep time in the brace to provide a passive improvement and correction to their scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.